Hello everyone and welcome. Today we're going to discuss about the key clinical indication for giving intrapartum antibiotic prophylaxis for someone who's positive for group B streptococcal infection in pregnancy. The mnemonic babies helps us remember the five main triggers easily. So the first one, bacteria. Any significant GBS bacteria in pregnancy indicates heavy colonization. So we treat the mother at the time of diagnosis and offer IAP at the time of delivery. Affected baby previously. A history of early onset GBS disease in a previous infant is one of the strongest predictor of recurrence. These women automatically qualify for IAP in labor. A bacterial swab positive. Any GBS positive swab from vagina or rectum indicates IAP at the time of delivery. And remember, here we don't treat the mother at the time of diagnosis. Why? Because antenatal treatment for vaginal or rectal colonization does not reduce the likelihood of GBS colonization at the time of delivery. The next indication, yes to labor risk factors, including prolonged rupture of membrane or preterm labor. Here, we automatically offer IAP regardless of the GBS carrier status. The last indication, sepsis. When someone has an intrapartum temperature of more than or equal to 38 degrees Celsius, we offer them broad spectrum antibiotic to cover GBS, such as IV amoxicillin or IV cefuroxime. And what is a standard IAP antibiotic? It's IV benzyl penicillin. So let's practice some questions relating to these key clinical indicators. As I've suggested in my earlier videos, try to look at the last line of the question because that helps you to stay focused on what you're expected out of the question. So in this case, you've been asked what is the most appropriate management. Now starting from the first line of the question. You've got a 30-year-old woman and she has attended her routine antenatal care. She is 26 weeks pregnant. A midstream urine sample has shown significant colony count of group B streptococcal infection. She is otherwise asymptomatic and her first child has no complications at the time of birth. So what is the most appropriate management? Here, you could see that this woman has got a significant colony count in her urine sample, which means we have to treat her now. And because she is group B streptococcal positive, we have to offer IAP at the time of delivery. So looking at all the options, the most appropriate management would be option D, which means treat now and offer intrapartum antibiotic prophylaxis at the time of delivery. This reinforces the importance of two-step approach, treat now and IAP later. So moving on to the second question, looking at the last line of the question, what is the most appropriate management? Let's go back to the first line of the question. You've got a 33-year-old woman with regular contractions, with cervical changes. She's 4 centimeter dilated, and she's at 36 weeks of pregnancy, which is essentially an established preterm labor. She's had a vaginal swab that was taken earlier in this pregnancy, and that has picked up group B streptococcal colonization. She's otherwise well, and the membranes are intact. What is the most appropriate management? So here it's clear that she is confirmed preterm labor, and she's had a positive GBS colonization before. So the most appropriate management would be to administer intrapartum antibiotic prophylaxis for her. Moving on to question number 3. Again, the last line. What is the most appropriate management plan for this pregnancy? So moving on to the first line of the question. You've got a 28-year-old woman. She has attended a routine antenatal clinic appointment. She's 26 weeks pregnant. Her previous baby had developed early onset group B streptococcal infection shortly after birth. What is a current pregnancy plan? So this clearly indicates a significant past obstetric history. Any previous affected baby automatically qualifies her for IAP in the subsequent pregnancies. So you offer intrapartum antibiotic prophylaxis in labor. We'll explore more about this guideline during a course which starts from January 2026 onwards. Thank you for your time and have a good day.